Hello, everyone. Welcome to our February Career Talk, Leadership in Action, Establishing Pathways in Cancer Care Equity. My name is Jayla. I use she, her pronouns, and I'm the project manager for the Cancer Leaders Like Us program. We'll give folks a few minutes to roll in, but I am going to prompt everyone to be social in the chat. In the meantime, if you could go ahead and put your name, your pronouns, where you're calling in from, please go ahead and do that. And then I also like to encourage folks to use and utilize the chat throughout the duration of this conversation, whether you have questions, any commentary, if you'd like to go back and forth with other folks that are attendees as well, please feel free to do that. There will be a time and space for question and answer at the end of the discussion that we're going to have. So keep that in mind, but feel free to drop questions as they come about, and we will make sure to get to them at the end. All right, I'm going to just go ahead and hop in, and those who will join us will join us. See, you can go ahead to the next slide, Shai. So like I said, my name is Jayla. I'm project manager for the Cancer Leaders Like Us program. You've probably seen my name. I've been sending out massive emails and reminders to everyone here. And so it's really good to see some familiar faces, really good to see some new faces as well. And then I will let Shai introduce themselves.
Hi, everyone. My name is Shai Seelot, and I'm a senior project associate here on CLUE, and it's great to see a lot of you again. And I'll pass it back to Jayla.
Cool. And then I will introduce Tennille Carter, who is from the National Comprehensive Cancer Network, and will be our guest speaker today. So if you want to go ahead and say hello for right now, Tennille, and then we'll get into our conversation a little bit later in the program. But I want everyone to see who you are.
Yes, of course. Hi, everyone. Tennille Carter, the manager of Cancer Care Equity at NCCN. I'm so glad you could join and looking forward to this conversation.
Awesome. Awesome. Okay, so since we have a few new folks that are here, I just wanted to, I didn't want to move forward without letting everyone know who we are as an organization. So the Cancer Leaders Like Us program is a program through the National LGBT Cancer Network. The network, which I will call for short because it's a very long name, but the network works to improve the lives of LGBT cancer survivors and those at risk by educating, training, and advocacy. And so we have those three different arms. Feel free to check out our website to see some of our other programming. We have an expansive resource library and a lot of other things that we do here besides just this career and professional development component. So tap in with us if you aren't already. And if you have come to Cancer Leaders Like Us through the network, welcome. You can go ahead to the next slide, Shai. So Cancer Leaders Like Us, for those who are unfamiliar, is a program for LGBTQIA and or BIPOC emerging leaders that are interested in health, public health, and specifically we want to get them interested in cancer and make sure that they have the supports that they need in order to be successful when entering that field. And so we do this in a variety of ways. Number one, everyone is here at this career talk. So we have a series of career talks that we invite folks that are in the community, that are in the profession, doing the work to kind of share a little bit about how they got here, what are some of the things that they're working on, some of the challenges, etc. So this is a space, I will say it is a networking space. So everyone that we kind of bring onto our career talks are people that I really want to introduce to everyone as a collective, and make sure that we're staying in connection with each other, whatever that means. Next, we do skill building workshops. We also have other networking opportunities. This past year, we are in our second year of Cancer Leaders Like Us. And so we developed an internship program in which we have a cohort of emerging leaders that have been placed with national organizations nationwide. And they went through a training curriculum, and that training curriculum covered things such as cancer health equity, tobacco, environmental risk factors, etc. And then they took all of the information that they learned during that curriculum and implement that in their respective host organization sites. So that's a little bit about what we are doing with Cancer Leaders Like Us. And then at the end, I will let you all know about another exciting program that we have coming up. But I'll save that for the end. And right now, I guess I want to just transition into a dialogue with Tennille, who I would love if you could tell us a little bit about yourself, just like a little brief bio, and then we could just go from there. And like I said, if anyone has questions throughout the conversation, please be sure to enter them in the chat.
Sure, so I'll jump right in. So I work at NCCN now. I've been in the oncology field for, in 2 weeks, it'll be 2 years. Sometimes it feels like 10 years or 2 days, in between. And I have a history of working in mental health and behavioral health, public health, and designing and implementing programs that were kind of joint public health and public safety, and just really focused on reducing harm to the individuals and the community. So a lot of my work has been focused in health equity itself, but my career has kind of been all over the place. So as many of you know, when you're coming out of like undergrad and going into grad school, you find yourself having a hard time finding work. And sometimes you find yourself just taking jobs. Some of them you don't like, and some of them you find yourself liking quite a bit and learning a lot. So that's kind of been the overarching theme of my career and getting me where I am today. But I like to think of myself as a burgeoning leader in health equity, and I love what I do.
Yeah. Yeah. And so I wanted to share with everyone else that I know you've done, and you mentioned like you came into this work of public health from maybe not specifically cancer, but that's how you that's the work that you're doing now. And so you were doing some work in the substance use arena. And I would love if you could talk a little bit about what you were doing exactly and how that work has helped you develop frameworks in the work that you're doing today with NCCN.
Yeah, sure. So I'll speak about my previous two positions before getting into this role. So I spent about 2.5 years working as an addictions therapist in Philadelphia, and specifically in the Kensington area of Philadelphia. So if you're familiar at all with the opioid epidemic, you know that Kensington is like the epicenter of it all. It's thought of as like the largest open air drug market. And so I worked at a clinic directly on Kensington Avenue. So I was in the heart of it. And I got to that was my first real introduction into public health, because, we start to get to know the syringe exchange programs, and you see the local public health department coming out and trying to combat Hep A outbreak. You see all these different screening vans, because they're trying to mitigate outbreaks of different STIs and things like that. So that was my introduction into like substance use disorders, public health, and kind of how they relate. So like I said, I was there for about 2.5 years, and then I loved my clients. It was a great job, but I knew that direct service wasn't for me. And so, I knew that I wanted to get kind of more into project management. And so I stumbled upon a position that was posted for the Police Assist Diversion Program. And that was new. It hadn't started. I was gonna create it. All they had was like an outline or an idea. And they specifically wanted someone who had experience in substance use disorders and criminal justice, and those things. So I thought, hey, I'm a perfect fit. And what do you know? The program was being implemented in the area where I grew up. So I'm from Philadelphia, specifically North Philadelphia, one of the most underserved poor areas in the city. And that's where they wanted to create this programming. And so I think that kind of tipped the hat for why they thought I was perfect for it. I knew what the community needed because I was a community member. So I was able to design that program in a way that was collaborative with other community members. It's, what type of approach do you need from us that would be most meaningful or make the greatest impact on you all? I had moved from the area, but it's, home is home, right? So I was able to use my 2.5 years experience to create that program, and I stayed there for about 3.5 years. It was successful. Anyone who engaged in the program was not arrested. And I also provided during that time additional support for another program called One Handoff. So that was inside of the hospitals. So police assisted diversion inside of the police station, One Handoff inside of the hospitals. And that program was focused on meeting people at risk for overdoses or presenting with an overdose, getting them into any type of supportive services. If they wanted to go to rehab, we helped connect them to that. If they just needed help meeting their immediate needs, we provided help with that. So those two positions, I learned a lot about project management, how to design and implement it from the very beginning until the end. I learned a lot in these patient chart or client charts about different conditions and medications and all the medical jargon that I find myself swimming in today. I learned a lot about during those positions. And then there's also learning more about the social determinants of health. That was like new language that started coming out, I think, in my last position. So I had to know, what that is, all the factors that can impact a person's health. So whether it's like their education, employment, transportation, food insecurity, I got to know what that was and how it impacts a person's healthcare experience. I got to know more about intersectionality and how different facets of a person's identity can kind of compound those determinants of health and different access issues. And I also got to know how mental health and physical health intertwine and how they impact one another. So there were a lot of things that I learned that kind of prepared me for this job and the way that I wanted to approach this job, which was another new job. Found myself in another pilot. I wanted to be collaborative with the community. I didn't want to come in and start these new initiatives in this new program and not consider the experiences or needs of the people who are going to be impacted by the different things we chose to undertake. So that's how it shaped my approach to this position.
Yeah, thank you so much for that background. And then, so I know what program that you are running at NCCN, but can you share what that, as you described, the pilot that you came into and what that program is and how you built it out today?
Yeah, so it's the Cancer Care Equity Program. It came out of just like an idea that leadership here at NCCN had. They knew they were already taking steps to like be intentional about embedding equity throughout the organization, but they wanted to undertake some specific initiatives and they didn't have anyone to do it. And so they thought, we are interested in these different things. Why don't we just house them in one program and then bring a person in to run that program? And so that enters me, right? So some of the things that fall into this program are the Health Equity Report Card and the Alliance for Cancer Care Equity. Now, these are two initiatives that came out of an Elevating Cancer Equity Working Group that NCCN had a year prior to me starting. So the Health Equity Report Card is, it was originally 17 measures, but we just did a press release. We added 2 new measures, so now it's 19. And it really examines how institutions are going about delivering their healthcare and their approach to DEI efforts within their institutions. And it's a way to kind of like measure how well or how poorly they're doing so that they, within their institution, can develop some strategies to do better. And so we have the Alliance for Cancer Care Equity that also came out of that working group. That's the policy arm. So that's, I think, 16 different measures of how to make lasting system change. And so that group has 3 focus areas, and that's screening and early detection, patient navigation, and clinical trial diversity. So they advocate for legislation that are going to fall in those 3 bucket areas. And I think we have like 20 plus patient advocacy groups and community-based organizations that are represented in that alliance. And then the third major thing that falls under this program is the DEI Directors Forum, also new. I created that about 8 months after I started, about 7 or 8 months after I started here. And what that is it's DEI directors from each of our member institutions. We have 33. And it's like a unifying space for them to like share best practices or challenges, and just really try to collaborate to like move the needle in the DEI space.
Awesome. Thank you for sharing those three. And then I have a question about, so for the report card, I know you said that it's like kind of used to measure like where folks are at in terms of like their equity practices. And you mentioned like to further assess those strategies. Do you all help them come up with new strategies as well? And can you talk about that process?
Yeah, so right now it's in pilot phase, so I can't say a lot about the process. So we're right now piloting the health equity report card in 5 of our member institutions. I can't say who they are, but I can say that they're geographically diverse, spread out, so we get, equitable results. And so we have an accompanying implementation plan for how they can try and sort of go through that report card and score themselves. It's kind of like a QI thing, sort of. And then, they do a score, like a self-score, and then we do a third-party score. We compare. And so there are low scoring areas. They then develop some implementation strategies, and we go back out 6 months after that to see if it's been working. So that's kind of the process of it. I can't get more details than that because we're in a pilot, but I can say that it's going well. And so we're expanding into the community setting. So right now we're in the process of selecting 5 community sites to also pilot this report card.
Awesome. And then you've done a lot within the last 2 years, like establishing those 3 programs through your role. Can you elaborate on what some of the challenges that you've encountered while implementing some of these frameworks, and how have you addressed them or navigated them?
Yeah, so I think one of the major things, like if you are creating anything that's new, you're going to have some people that are kind of like resistant to change. So that's been a major thing. And then just, I mean, like you said, it's been a lot, and I'm one person, I'm the entire equity program. And so sometimes we find ourselves wanting to engage on certain things and we just simply don't have capacity at the time. And, you can only do but so much. So right now we're looking at building capacity and potentially getting more help so that we don't to like say no to certain things that we want to engage on. But also with like the DEI forum, the evolving landscape of DEI in this country, and just like how certain states are trying to like strike down DEI programs. And it's been challenging because one of those states, we have 2 member institutions. And so we're trying to figure out how to help them navigate like their new reality. But it's hard,
Yeah, and I know that goes into like the huge like policy reason. I always say that cancer and health, our health in general, is very political, whether people like to acknowledge it or not, because like there can be an evidence-based framework, but then if you are located or living in a state where you cannot actually implement said framework because of the legislative nature or whatever policy-wise is going on. I know that's really a big issue in like reproductive justice world and landscape. So thank you for sharing that. And so the folks that are in the directors forum, they are like, would you say it's kind of like a coalition, like everyone is in conversation together to kind of talk about the different things that they're doing and kind of learn from each other?
Yes, I will say that this group is extremely collaborative, and they're some of the smartest people I've ever met. So I'm just lucky I get to work with them. But then also, most of the people that are on the forum, that's not their primary job. Their primary job is not DEI. That's kind of a second job that they were given. Just because, I mean, their board knew they would be good at it, but also they just don't have enough staff. So you have some people that their primary job is like an oncological surgeon, And then they have to also go and advance DEI efforts. So you're talking about a person that's spread extremely thin. And then this group itself, one of the major things we established early on were that we didn't want to be a group of people who just got together and talked. Like, we just didn't want to be another one of those groups. We wanted to be very action oriented. So, you know, now you have a group of doers who want to get things done. And so we are in the process of creating two work products. One is on like collection of demographic data in cancer institutions, and the other one is kind of examining the current DEI landscape and also responding to the SCOTUS affirmative action ruling and the impact that that will have on cancer care. So again, these very busy people, and then we're trying to do meaningful work products like this. So it's a lot.
Yeah, no, coalition work, for those who haven't been engaged, it's, yeah, usually we all have our main things, and then we're coming in and only meeting like once a month, and trying to make something happen from there. So yeah, thank you for sharing. And so I'm interested in knowing like what you personally envision for the future of cancer care equity, and if it's reflective of also what NCCN envisions. That's awesome as well. But yeah, wondering what you envision in the future and how you could see like people that are stepping into this field and this work supporting in that mission and vision.
Yeah, so for NCCN, I mean, we have our heels dug into the initiatives that we've already undertaken. But we have started to think about like kind of what's next and what it would look like to expand this program. And we're still in the beginning stages of that. So there's not much to say personally for NCCN, you know, where we're going. But things that I've seen that are kind of like ever evolving are just things like telemedicine, you know. Since COVID-19, we've seen a boom in telehealth, and we've, you know, been able to see kind of the great benefits of it. I think that's one area definitely to watch for people who are getting in here. I'm seeing more and more like digital health positions every day. And then I think there's going to continue to be an emphasis on like the importance of screening and early detection. We're seeing more screening vans or like mammography vans that are going to kind of meet the people where they are. We've seen a great increase in screening rates because it's making these things more accessible for people. And then you have things like at-home stool sample kits. So people are able to have these things done in the comfort of their own home. And it's also helpful if people don't have a way to get their testing done. And, you know, screening is important because the earlier that you find out you have any type of diagnosis, the better your chances or outcomes. I think these are like the big areas that are going to keep booming. And then also, I'm finding that more people are starting to understand or even accept that like the importance of culturally responsive care. People are, you know, starting to realize that you can't approach every patient the same. You still have some holdouts who think that they can take the same approach to every patient, but I'll say for the most part, most of the providers that I speak to these days are beginning to understand that. So it's just figuring out what their approach is going to be to culturally responsive care. So I think that's another thing that's going to keep booming.
Yeah, no, I think that the culturally responsive care deeply resonates. As I was on a breast cancer training yesterday for Black women in the San Francisco Bay Area, and they closed out the training with a prayer. And I was just so shocked because obviously, like in the, you know, for the African American culture, like spirituality is very, you know, it's at the forefront. And it was just, you know, the facilitators were Black women, Black oncologists, and they let the community members like lead the space. And I thought that was very culturally responsible and responsive, you know, to all of the women that were there, because they just seemed even more engaged because it was a space that they can show up very fully as themselves. So yes, snaps to what you said about the cultural responsiveness, and not being able to treat everyone the same. So I know also that in addition to all the wonderful things you're doing at NCCN, you're also pursuing a doctorate degree. So how is that going? And can you share a little bit about how you're navigating that at the moment?
Yeah, so it's a lot. Uh, 10 out of 10 recommend for anyone who knows what they want to do, but if you're on the fence, figure it out first because it's a lot. It's a commitment. You need to be very, very sure. But yeah, navigating is time management. And I'm lucky that I've spent the last, I don't know, 6 years as a project manager. Time management has been my life. So it's kind of sticking to what I know and just integrating this new reality into, what I already have going on. I'm lucky that I have a very supportive supervisor. She always lets me know, hey, if you need to like come in later, leave early, if you need a mental health day because your brain is fried, like just, let me know. And it also helps that she's also a doctoral student. So she is, I want to say a few months away, like she's in the dissertation phase. She already finished all of her coursework. So she's intimately experienced with this process. So I'm very, very lucky with that. But yeah, it's been going great. Difficult, but great.
Yeah. And then another question I had for you. So we have like a few emerging leaders on the call today. And so what advice would you give to our emerging leaders that are aspiring to make a more meaningful impact, and especially more meaningful impact in addressing some of the inequities that are very persistent within our like healthcare systems?
I would say, people are trying to get engaged. Start with like a knowledge foundation first. Figure out what you want to do. Do you want to work in public health? And what does that mean? Do you want to be in biostats? Do you want to be in epidemiology? You want to work in oncology? What part of that do you want to work in? Do you want to be a project manager? Do you want to be a nurse? I don't, it's like figure out exactly what you want to do and then build your knowledge in it. People feel like you're more reliable when you know what you're talking about. And then, as an emerging leader, you don't want to be in a position where more often than not, when someone is asking about a current trend in your chosen field, you're unaware. So a lot of, reading, talking, networking, those sorts of things, just like stay on top of it, cultivate your partnerships, collaborate with people who are like-minded and, have the same goal as you. Like for us, we all want to advance health equity, connect with people like that. Our impact is stronger together. So, I mean, that's kind of like the basis of it.
Yeah. And then I know that, and this kind of goes back to like now that we have like a full picture of like who you are and how you've kind of navigated your career up to this point. And so did you find it challenging implementing an equity program within an organization that didn't have like a formal one in place? Yeah, I would like to know about like your experience.
I mean, I want to acknowledge the luck that I had that I was building it in this specific organization just because they had already decided that this was something that was meaningful to them. They added equity to their mission. That's how important it is to this organization. Everybody's experience isn't going to be like that. I've been in jobs where I've tried to implement things and got a lot of pushback because there was no buy-in or people lacked education about the subject matter, lack of awareness. And so in those points, you have to rely on educating the people who are giving you that resistance. It's just, sometimes people don't like to admit that they don't know what they don't know, and it's making sure that when you're trying to educate the people who are giving you resistance, due to a lack of their understanding, you're respectful about it. People have had their own experiences that have shaped like who they are. So just like keep that in mind. But me personally, I was very lucky that they were receptive to me. Some of the challenges have been that a lot of our initiatives are externally facing, and we could benefit from some more internal DEI efforts. So we are actually talking about that now, because I'm like, we're asking people to do X, Y, Z, but I think we're missing this one. And so far, leadership has been like receptive to, what I've been saying, but that's been a major challenge.
Mhm. Yeah, I think that's a challenge across the board, especially when, like, I know it's like the network, for example, like we're a nonprofit, so capacity is already very strapped, so how do we squeeze that in and not also assume and let the burden of implementing health equity fall on, the people that have all of these different identities as well, because that can be laborious for, folks that are inside of the organization. Is there any place that you look like for, or that you look to for guidance on your health equity work?
Yes. So, for example, it depends on what I'm trying to do or accomplish, because like most of our initiatives are very specific. So whatever that specific thing is, I want to know who's a leader in that space. And like not just a leader in terms of who can speak the loudest, but a person who is actually genuinely interested in making like meaningful, lasting change. And so we, for example, in December 2022, we had a patient advocacy summit on addressing the unique needs of LGBT community in terms of cancer care. And so I didn't want, a bunch of cisgender people talking about what they think the experience is like. I want to go straight to the source. One of our most amazing speakers at that summit was Scout, who was fantastic. And I think another one of our speakers are on here too. I think I saw Paula. She was also phenomenal. But yeah, it's just really going to the people who are the experts. They have the experiences and they want to make a difference. So whatever specific initiative we have going on, I'm going to go find those people, and rely on them. I want to amplify their voices and their stories, and yeah, that's how I do it.
Thanks. Okay, I think those are all of the questions that I have for you. But I would like to open it up to our amazing audience to see if anyone else has any questions that they would like to ask Tennille. And you can come off mute, you can put it in the chat, whatever you feel comfortable with. I can ask questions all day, but I would like to give other people space to do so. So yeah.
I have a question. Hi, Tennille. Hi, Jayla. Thank y'all so much for this meeting tonight. It's so meaningful. So glad I got to hear your story and just your experience. It's really great to hear it from someone who's working and they can give their real life experience. And you brought up what it's like to work for a boss that cares. And to be honest with you, I worked in a different kind of industry for the first half of my life. And I never had bosses that cared. So I never knew what it was like to take in consideration my needs above my job and how it would affect my job. And I'm actually much better for it. So I was just wondering if you could talk more about that and how important that is in your job search.
Okay, yeah, sure. So I'll say this is the first time I've had this experience because, I've had some very poor experiences, and some of those I had shared with my boss and coming in. Her name is Alyssa Schatz, by the way. She's fantastic. And so I always tell her, Alyssa, you're the best boss I've ever had. And she always jokes, hey, the bar was low. But it's just like, no, you're really great. She, she identifies as a cisgender heterosexual white woman, but she is a person who has demonstrated a certain level of understanding. And if she isn't sure about something, she'll ask. She doesn't want to like make assumptions, and she doesn't want to take up space that is meant for us to speak up. She wants to kind of push us forward, which she has. She's had people like reach out to her and ask her certain like DEI related questions or things that would be more appropriate for a person from a marginalized community to answer, and she'd reroute them to me. So it's important to work for someone who gets it, you know, whether they identify the same or differently as you, just someone who's going to actually support you.
Thank you, Paula. That was a good question.
It was.
Okay, anyone else? Okay, then I have another question then, since since there's time and space. I know when you and I, when we first got on a call and talked, you talked about like segue positions and kind of a transition from the substance use arena into the work that you were doing in Philadelphia to the work that you were doing now. So I think I would love for you to share a little bit about like, you know, the value that you place on segue positions and what those mean to you, especially I think in the field of public health. I know when I got my master's in public health, everyone was like, what are you going to do? And I'm like, the world is, there's so many different things. And that's why I went into this field, is because, you know, a lot of, obviously it's like, you know, different, it looks different, but like the same approaches are often similar between whatever you're going into, right? So I would love if you could share a little bit about, yeah, segue positions and kind of what that means, just navigating through different sectors of the public health field.
Yeah, absolutely. So segue positions are everything to me. They are what got me here. Sometimes you find yourself like in, you feel like you're in a rut. You're like, you know, I don't think I'm getting anything out of this position. I don't know where to go next. You might receive an offer from somewhere that is less than ideal. It's not what you sought out for. But sometimes your growth and experience lies in taking those sorts of positions. Like, I was working in a law firm and I thought, I am bored to tears, like what's next? And then I received a call from, it's called the Philadelphia Mental Health Center. I knew I didn't want to work there, but I thought, hey, it's getting me closer to healthcare, because I had figured out that I somehow wanted to get somewhere in there, but I wasn't quite sure where. And I thought, hey, I could, you know, this is behavioral mental health. I could kind of figure out if that's the sector of health that I want to be in, whether I like it or not. And so I took it. It only paid me like $2 more than I was making at the law firm. It was in the same neighborhood, so the commute was the same. But it helped me a lot. I worked there for I think only 5 or 6 months. And it was because of that experience that I received the call from the outpatient clinic in Kensington when I became an addictions therapist. They saw that I had that experience at the mental health clinic, and they were like, you know, we could use her. And so sometimes they just propel you forward, and it's just like recognizing that things can be stepping stones and you don't have to stay there. Or it could be, you know, you heard about this place and they want to offer you a position and they have like a significant training fund. Go work there and let them pay for your trainings to build up your education. So yeah, segue positions are amazing. I swear by them. I have a colleague on the call, Lorraine, who I gave a lot of talks to about taking segue positions over the years. They're just super important.
Thank you. Okay, now I'll be done asking my questions now. Okay. If no one else has any questions, we can just transition, I guess, to announcements. But I just wanted to say thank you so much for sharing your insights. I personally am connected with Tennille on LinkedIn, and when I tell you that she's always sharing very meaningful opportunities and just like other little, I call them gems, dropping gems that I always see just throughout the week. So if you would like to connect with Tennille, please feel free to do so. And then Tennille, if you would like to drop your information in the chat. We love for this place to be where you are introduced to someone, but not where the connection ends. So please take advantage of, you know, all of the lovely technology that we have to keep in touch with folks. Okay, so the Cancer Leaders Like Us program, we are doing something new. And I think this is a great segue from the conversation that we were just having about like kind of career development and what that might look like. We are going to be hosting a Cancer Career Summit. This is a very free and very virtual event. So hopefully that makes it accessible to everyone to be able to come. But basically what it would look like is we're going to be having a career readiness workshop, and then that's going to be followed by a career fair. And it's also for students, it's for people that are early career professionals. If you are already in the field and you're interested in transitioning maybe into a different sector, or even just learning about what that might look like, then you're more than welcome to come. Pre-registration is open now. Shai just dropped the link in the chat. And so once you pre-register, we'll be sure to send you more information on how you can stay engaged with the Cancer Leaders Like Us Cancer Career Summit. And this is going to be our first one. So that's super exciting. If you're calling in and you're like, I'm not technically looking for a position, but I work at an organization and I have something that I would like to share, we're also going to be having like exhibitor tables as well as folks that are, you know, looking for positions to fill. And so even if there's a training program that you just launched throughout your organization and you want people to be more made aware about it, this is a lovely space for you to be in as well. So I would go ahead and pre-register, and then there's an option for you to select how you would like to participate and engage with us then. But I think that's everything that we have. Thank you so much for tuning in today. If you are not connected with me and would like to be, my email address is on the slide that you're seeing on your screen. And I just wanted to thank everyone for taking time out of your evening to come today, and hope that this was fruitful for everyone that attended. So thank you so much, everyone, and have a good night.